Hello and good evening everyone. Today I want to present about the topic of suppository. Next, these our teammates. I'm Nur Saidato Amira binti Muhammad Sahid, Nur Syuhada binti Alias, Nur Dayana Azhara binti Ahmad Jaiz, and Nur Ain Izzati binti Muhammad Bakrizan.
Today I want to introduce about suppository. An introduction suppository is a medication that is inserted into the rectum to introduce medication into the body. It is often used when a person is unable to make medication by mouth or when a medication needs to bypass the digestive system for better absorption. Suppository come in various forms, including medicated, laxative, and hemorrhoidal suppositories. They can be used in both adult and children, but it's important to follow the instruction provided by a healthcare professional for proper use.
The first one is Dreminate suppository 50 mg. Active ingredients is each suppository contains dimenhydrinate 50 mg. Dosage for each of the age group adult 1 to sub 50 to 100 mg, 6 to 8 hourly. For prevention of motion sickness, insert into the rectum 30 minutes. Preferable 1 to 2 hours before traveling. Child 8 to 12 years, 1 suppository, 50 mg, 8 to 12 hourly. Next is inactive ingredients. Vitepsil. The inactive ingredients in Dreminate suppository typically include Vitepsil, a blend of saturated triglyceride derived from vegetable source, glycerol, monosaccharide, and polyethylene glycol. These ingredients serve as the base and help in the dispersion and delivery of the active ingredient, dimenhydrinate in the suppository form. Next is the indication. Dreminate dimenhydrinate suppository are commonly used to prevent and treat nausea, vomiting, and dizziness caused by motion sickness. They are also used in the management of vertigo, a spinning sensation associated with disease affecting the vestibular system, such as Meniere's disease. Next is a concentration use. The typical concentration of dimenhydrinate in Dreminate suppository is 50 mg per suppository. This is a common standard dose for adult use. However, the actual concentration can vary, so it's important to follow the specific instruction provided by the manufacturer or healthcare provider. Next is a side effect. Dreminate suppository may cause drowsiness, especially in children and occasionally in adults. Other adverse effects include headache, blurry vision, dryness of mouth, and respiratory passages. Incoordination, feeling of fast or irregular heartbeat, dizziness, and low blood pressure. Next is how Dreminate suppository works. Dreminate suppository works to relieve or prevent vomiting by affecting the vomiting center in the brain. It relieves vertigo by affecting the brain and inner ear. When to use it? Dreminate suppository should be used to prevent motion sickness, thus to be inserted into the rectum 30 minutes, preferable 1 to 2 hours before traveling. Before you use Dreaminate suppository, taking other medicine. Dreaminate suppository may cause unwanted effects if used together with other medication, such as barbiturates, alcohol, tricyclic, antidepressant, monoamine, oxidase inhibitor, aminoglycoside, antibiotics, and other medicine that cause damage to hearing or balance function of the ear. You must also inform them about all the medicine you are taking, including those without a prescription. Next is storage and disposal. The first one is storage. Store at temperature below 25 Celsius, protect from light and moisture. Next is a disposal. Remaining suppository should be disposed when your doctor or pharmacist tell you to stop taking this tablet or it has passed the expired date. And you should ask your pharmacist how to dispose medicine that are no longer required. The next is a symptom and treatment for overdosage. If you too much overdose may cause uncontrolled body movement, excitement, tremors, hallucination, and convulsion in infants and children. In adult, it can lead to drowsiness, coma, and convulsion, leading to respiratory failure and cardiovascular collapse. Seek for medical attention as soon as possible if overdose is found. Treatment for overdose typically involve supportive care, which may include monitoring or vital signs, administering active charcoal to help absorb any remaining drug in the stomach, and providing intravenous fluid if necessary. In several cases, antidotes such as pisostiquimine may be used under medical supervision to reverse the effect of deminergic overdose. However, the use of antidote is rare and generally reserved for several cases under the guidance of a healthcare professional. The next is a product description. What it looks like: a white to off-white suppository, 10 sub per strip, 10 strip per box.
I will present about Poro suppository. So this is the active ingredients for Poro suppository. Poro suppository come in 4 strength, which is 125 mg, 250 mg, 500 mg, and 1000 mg, each containing paracetamol, acetaminophen at the respective dosage. This is the dosage for each of the age group. So for the first of all, the recommended dosage for children aged 1 to 2 years in one suppository of 125 mg. For children aged 2 to 6 years, it is 1 to 2 suppositories of 125 mg. And for children aged 6 to 12 years, it's 1 to 2 suppository of 250 mg to be inserted into the rectum every 4 hours as needed up to 4 times daily. For children aged 10 to 12 years, 30 to 40 kg, one suppository of Poro 500 is recommended every 4 to 6 hours, up to maximum of 4 suppository in 24 hours. While for adult and children aged 12 years and above, 1 to 2 suppository of Poro 500 mg can be taken every 4 to 6 hours, up to a maximum of 8 suppository in 24 hours. And for adult, 1 suppository of Poro 1000 mg can be taken every 4 to 6 hours up to maximum of 4 suppository in 24 hours. When to use it? Poro suppository should be taken according to the time advised by your doctor or pharmacy. It can be taken with or without food. The side effect of Poro suppository is side effect of paracetamol are usually mild to hematological reaction, skin rashes and other allergic reaction, cutaneous hypersensitivity reaction including skin rashes, angioedema, Stevens-Johnson syndrome, toxic epidermis have been reported. For inactive ingredient, the inactive ingredient is white capsule. White capsule is one of the inactive ingredients used in the formulation of Poro suppository, contributing to their structural integrity and dissolution properties. So for the indication is for the symptom relief of fever and pain, headache, muscle. So the Poro suppository provide effective relief for symptoms such as fever, headache and muscle ache associated with the common cold, offering comfort and ease of use for patients seeking relief. The concentration used for paracetamol, acetaminophen used in suppositories are 125 mg, 250 mg, 500 mg, and 1000 mg, respectively. The symptom and treatment for overdosage is toxic symptoms include vomiting, abdominal pain, hypotension and sweating. Jaundice, hypoglycemia and metabolic acidosis are major manifestation of liver failure, which may take at least 3 days to develop. In case of suspected overdose, getting emergency help at once even if no apparent symptom of severe overdosage may be delayed, but treatment must be begun as soon as possible. Treatment started 24 hours or more after the overdosage may be ineffective in preventing liver damage or fatality. Acetaminophen to 20% is given by intravenous infusion as antidote by physician. Storage condition is Poro suppository for 125 mg. The storage is stored at temperature 25 Celsius, protect from light and moisture. For Poro suppository 250 mg, the storage is stored at temperature 13 Celsius, protect from light and moisture. For Poro suppository 500 mg and 1000 mg, the storage is same, stored at the temperature below 25 Celsius. The product description and packaging. A white to off-white spindle-shaped suppository. The first one is Poro suppository, 125 mg, 5 suppository per case, 5 suppository per strip, 2 strip per box, 10 suppository per strip, 10 strip per box. Second one is Poro suppository 250 mg, 5 suppository per strip, 10 suppositories per strip, 10 strip per box. And the last one is dosage form and packaging available for 500 mg suppository, 5 suppository times 2, 1000 mg suppository, 5 suppository times 2. The shelf life is 3 years.
Next, we continue with oral suppositories. Oral suppositories used for chronic rheumatic arthritis, systematic inflammatory disorder, that affect joints. Degenerative osteoarthritis, degenerative joint disease, and painful post-operative inflammation. How Vorus suppositories work? Vorus suppositories contain a substance called diclofenac. Diclofenac is a non-steroidal anti-inflammatory drug which reduce inflammation, pain, and fever. Boron suppositories active ingredients in diclofenac sodium, which is have three strength, 12.5 mg, 25 mg, and 50 mg. Inactive ingredient in white salt. White salt hard fats composed of fatty acid and glycerol. Fatty acid and glycerol are based on vegetable sauce. White salt hard fats are white or almost white, brighter to slightly soft and odorless excipients in a pencil shape. Dosage for each of the age group is for adult 100 mg, usually at night. Maximum total daily dose is 150 mg. For children, 0.5 to 2 mg per kg body weight daily in 2 to 3 divided dose to be inserted deep into the rectum. Warren suppository side effect is one, local irritation, can make itching, burning, and increase bowel movement. Next, central nervous system, can make dizziness, headache, insomnia, drowsiness. Next, hematologic system, for blood, hematologic anemia. Next, allergic. Can make hypersensitivity reaction. Next, ophthalmological, for eyes. Can make blurred vision. Next, hepatic, for liver, can make jaundice and hepatitis. Next, for dermatologic system, for skin, can make rash, pruritus, skin eruptions, eczema, urticaria, and also erythema. Commercial packaging and available product strength is 3, 12.5 mg, 50 mg, and also 25 mg. Commercial packaging is white to pale yellow color spindle suppositories. 10 sub per stripe, 10 stripe per box. The storage is below 25 Celsius, protect from light and moisture.
Next, protosodide suppository. What protosodide suppository is used for? Protosodide suppository can be used for short-term relief of first, pain, irritation, discharge, and itching related with a large of swollen vessel around your back passage or hemorrhoid. Second, pra and post-surgery to remove hemorrhoid. Third, postnatal, after giving birth, hemorrhoidal conditions. How protosodide suppository works? First, chinchokin hydrochloride belongs to a group of medicine called local anesthetics. It works by causing numbness in the area to which it is applied. This stops feeling pain in this area and helps lessen the spasm of the back passage. Second, hydrocortisone belongs to a group of medicine called corticosteroids. It works by lowering the production of substances that cause inflammation. This helps lower swelling, itching, and discharge. Last, pharmacin sulfate belongs to a group of medicine called antibiotics. It used to treat local infections. Next. Active ingredients have four. First, chinchokin hydrochloride. Second, hydrocortisone. Third, pharmacin sulfide. Last, insulin. When to use it? Use protoxide suppository at about the same time each day unless doctor tells otherwise. Dosage for each of the age group. First, adult. 18 years and older, typically one suppository in the morning and night after each bowel movement. Second, the protoxide suppository may be used separately or concurrently. Inactive ingredients is a Sapokaya AM. The inactive ingredients is protoxide Sapokaya AM. Suppository may include cocoa butter, propylene glycol, sodium lauryl sulfate, and butylated hydroyanisole. These ingredients are not the active ingredients that treat the condition but are included in the formulation for various purposes like stability and manufacturing. Excipients in the case of protoxide suppositories, excipient may include substances like hydrogenate, vegetable oil, hard fat, and other miscellaneous components that are non-medicinal in nature. These excipients help to form the suppository shape, preserve the medication, and aid in its absorption or function within the body. It is important to note that excipients do not have any therapeutic effect on their own. They are only added to facilitate the manufacturing and administration of the medication. Then side effect. Protoxide suppository can cause side effect, although not everyone get them. Concentration use. The concentration of the active ingredients in protoxide suppository may vary depending on the specific formulation and manufacturer. However, a common concentration of hydrocortisone in protoxide suppository is 5 mg, while cichokin is typically present in a concentration of 10 mg. Do not be alarmed by the list of possible side effects. First, may not experience any of them. Second, if use protoxide suppository for a long period of time, it is possible that you could get something called adrenal suppression. Signs include lack of appetite, pain in the stomach, weight loss, feeling sick or being sick, lack of concentration, a feeling of hunger, nervousness, and fits. Last one, other side effects not listed above may occur in some people. Commercial packaging and available product strength. The available product strength of protoxide suppository may vary, but commonly it is available in two strengths. For protoxide 10 mg per 10 mg suppository and protoxide 20 mg per 20 mg suppository. These strengths indicate the amount of the active ingredients, such as hydrocortisone and chicotin present in each suppository. It is important to follow the recommended dosage and strength as advised by a healthcare professional for safe and effective use. Storage conditions. First, keep this medicine in a safe place where children cannot see or reach it. Second, do not use protoxide suppository after the expiry date, which is stated on the label and carton. The expiry date refers to the last day of that month. Last one, store at 2 Celsius to 8 Celsius. Refrigerate, do not freeze. Product description. What it look like? Protoxide suppository are smooth and off-white in color. They are available in packs of 12. Last one, for last suppository, is Precolate suppositories. What is Precolate is used for? For the treatment of constipation before or after operation, evacuation or evacuation before radiology. How Precolate works? Bisacodyl belongs to a group medicines known as stimulant laxatives. Stimulant laxatives increase bowel movement. Active ingredients is bisacodyl. Bisacodyl is the active ingredient in many over-the-counter laxatives. Dosage form each of the age group. First, adults, 10 mg when necessary. Second, children, 4 to 10 years, 1 suppository, 5 to 10 mg when necessary. Before giving a laxative to children under 6 years, the doctor should be consulted to be inserted into the rectum or bed passage. Indication is constipation. Constipation is when your bowel movements are less frequent or difficult to pass. It can cause bloating, discomfort, and hard stools. Drinking water, eating fiber-rich foods, and staying active can help prevent constipation if you are concerned. Inactive ingredients is Subanal EF 37. Inactive ingredient in a medication refer to substances that do not have a direct therapeutic effect but are included for various purposes, such as binding the active ingredients together, providing bulk, or improving the medications as apparent test or stability. For example, in the case of Precolate Subanal Suppository EF 37, inactive ingredients may include fillers, preservatives, coloring agents, and lubricants. Excipients. In the case of Precolate suppositories, the excipients are substances that support the bisacodyl active ingredient in providing relief from constipation. This excipient may include ingredients such as white Tepsol, hard fat, or other substances that help form the suppository shape, aid in absorption, and provide a comfortable application. Excipients are important in pharmaceutical formulations to ensure the medication works as intended and is safe for use. Side effect for Precolate. Precolate can cause side effect, although not everybody get them. It sometimes causes irritation, and repeated use may cause inflammation of the rectum and anus. May occasionally cause severe abdominal cramps, diarrhea, bleeding, or nausea. Next. Commercial packaging and available product strength. First, Bisacodyl YSP sub 10 mg, 10 times 10. Second, Bisacodyl YSP sub 5 mg, 10 times 10. Product description and storage conditions. Product description, what it look like? White color suppositories. Storage conditions. First, store in a cool, dry place below 30 Celsius. Second, protect from light. 3, keep out of reach and sight of children. This for last one, for conclusion, When considering the use of suppository for medication delivery, the conclusion might be the suppositories offer an alternative route of the administration for individuals who have difficulties swallowing pills or need a more direct delivery of medication. They can be useful for treating conditions such as nausea and vomiting that may impact oral medication absorption. In summary, suppositories have their place in medical care but should be used judiciously and under the guidance of a healthcare professional to ensure safe and effective use. That's all, and thank you.